Hello, 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 everyone. This is Helen Higginbotham coming at you again this Sunday with When Black Women Gather. I'm so happy to have you all here on this Sunday before the holiday kicks in. We're going to talk a little bit about how we can, our topic today is how do we advocate for ourselves as health advocate, Black health advocacy, if not you, who? Because honestly, if we're not advocating for ourselves, who will? And honestly, who should? So today we're going to, our special guest is Kerry Ann Dixon. Kerry Ann and I actually work together, and she's just so into, um, um, she's like me, she's on the Black card, she's on the Black team. So I wanted to have her here to talk to us specifically about health advocacy. But I want to tell you a little bit more about her. She actually does a lot of work around prenatal and delivery issues for Black women. So let me just real quickly read her bio. Kerry Ann Dixon is a distinguished figure in the field of maternal child care, widely recognized for her effective leadership and community-focused approach. She has established herself as a champion of racial justice within this field, having served as a nurse home visitor for the esteemed Nurse Family Partnership Program. In her role as an obstetrics nurse, Kerry Ann has been instrumental in helping many first-time mothers navigate the challenging transition to motherhood. Additionally, she has served as a community health nursing consultant for the Women's Health Initiative, Nurse Family Partnership, and childbirth educators, Creole and Spanish. That's very prevalent in Florida. She's did that with the Department of Health in Palm Beach County. Currently, she holds the position of Program Performance Officer for the Children's Services Council of Palm Beach County, where she continues to demonstrate her unwavering commitment to the welfare of families and children. Her expertise has been recognized by the Black Mothers Breastfeeding Association, where she is a member of the inaugural cohort of the Birth and Breastfeeding Leadership Institute. She is also a nominee for the Neighborhood Works America Dorothy Richardson Award for Resident Leadership for her community as part of the Riviera Beach Health Initiative. And she is currently getting ready to join the Doctors Club. I see a few of you ladies, Sandra, you just got there. So she is currently working on her PhD in nursing with a focus on health equity, with the particular interests and experiences of Black women in the maternal child health field. And her extensive knowledge and expertise makes her an invaluable asset to advocate for better health outcomes for Black families. And that's, let me bring her on screen. That's basically today why we have her here, to not so much talk about the, oh, wait a minute, I replaced you, I was supposed to add you. So not as much to talk about maternal things, but if those are your questions, then by all means, she will field those as well. But hey, Kerry Ann, how you doing, girl?
Hey, I'm doing well.
Thank you so much for giving up your time today. I know it's Christmas time and people are busy, busy, busy. So today, you know, Kerry Ann's going to do her presentation. I'm going to go online and recorrect the mistake that I made while she's talking to you. And Kerry Ann, what do we decide? Are we going to take questions at the end or throughout?
No, I can take questions throughout. That's fine.
Okay. So if you
I
have
do
a
have
question,
slides. I do have a deck that I'll go through, and you can go through the slides as well and ask questions throughout. I like to be interactive. I'm an educator as well, so
yeah.
I can take questions
And you didn't
throughout.
mention that beautiful baby girl that you have.
Yes, I do have this beautiful baby girl that we have a Girl Scout event this evening that we are going to do a pajama party. So I have a beautiful baby girl that is 6 years old, and I also have a handsome young man that is 23 years old. So I have a big gap, and have learned so much about myself in this journey of motherhood. And I say that God gives you exactly what you need and gives you the type of child that you need, that he brings out the best in you in each child that you have. So he had to teach me certain things with my son, and I needed to basically learn the discipline and achieve my goals and things like that. And then my daughter is teaching me to slow down and just savor everything and smell the roses. So
Yeah.
that's what I'm learning from my children.
Yeah, she's quite a little girl. I've had the pleasure of meeting her. So I'm going to go off screen, turn it over to Kerry Ann. If you all have questions, put them in the chat. Right now, if I could just ask everybody to be sure and mute yourself so that you're, because sometimes we forget that we're not muted and we start talking. So if everybody could mute themselves, and I'm going to turn it over to Kerry Ann. So thank you so much again, Kerry Ann.
Thank you. And thank you for having me. I've had the pleasure of joining you guys during a few of the sessions. So I've gotten a chance to spend some time with you all for a little bit. So it's actually been really enriching, and I really enjoyed my time. So hopefully I can do justice to some of the things that I'm going to be bringing you. And I did hear that we do have a young man on here as well. So hopefully I'll be able to give you some nuggets for yourself as well. So like Ms. Helen said, I am Kerry Ann Dixon, and I am a master's prepared nurse currently working on my PhD, and we'll get right into it. So we'll kind of go over, because of course, here are my objectives I'm going to be covering with you. So we'll talk about year in review, plan for your year, the benefits, money, advocacy, and then conclusion. And then we'll kind of go over ways to keep in touch with me. And my disclaimer is that these are my opinions. These are thoughts and opinions of my own. So please seek legal and medical advice that are specific to your individual situations. All right, so your year in review, we are out for most companies, I believe, or if not all companies, but we are outside of your normal window that you would actually do your benefits and things like that. So, but this is the time that you want to take a look at your, to schedule a time with your HR to kind of take a look at what are some of your benefits that you have left on the table, particularly like your FSA, your HSA, if you have some dollars left that you can still use, because you do have a time limit of when you can use those dollars. So you want to kind of take a look at that if you have not used up everything already. You also want to schedule those appointments if you do have some time, some money's left. If you haven't gotten your physicals in, I realized I switched jobs. So I just actually hit a year at my job, and I normally, for myself, just so it's easier to remember, I schedule my physical in my birthday month, so it's easier for me. But I realized when I switched jobs, my new insurance kicked in after my birthday, which is in February. And I was like, wait a minute, I haven't seen my girl. So I actually went to see her last week because I said, wait, I haven't seen her. So I scheduled my time to go out and see her. So I made sure I hit everybody else, because that was me doing my year in review and looking at it to make sure that I hit all my specialties and everything that I needed to take care of. And then you also want to make sure that with those FSA dollars and your HSA dollars, because we don't want to leave money on the table, because I'm a big proponent of making sure that we have our financial house in order as well. So making sure that we have our documents prepared and submitted. Some insurance companies will give you back dollars for as part of your benefits package. So want to make sure that you have your documents prepared and submitted, because sometimes we'll prepare the documents and we're like, okay, I'm gonna get to it. No, carve out a day, carve out some time on your schedule to actually prepare it and submit it, whether you have to hold the explanation of benefits or whatever it is that you have to do. But you want to make sure you actually submit it, because you don't want to leave money on the table. And then also you want to evaluate what you have spent. Again, you're probably outside of your window, but for some things you can always contribute to your HSA at any time. So take a look and see if, because this will also help you in terms of your taxes, because we've lost a lot of the monies that we can actually claim in your taxes. Like, we don't get credit for like your donations and things like that anymore that we used to be able to itemize. So these are some ways that you can actually use your taxes, benefits in terms of your taxes. So you can take a look at what it is that you're actually spending, so you can max out the use the max dollars for yourself in terms of your health savings plan. So take a look and see what it is that you're actually spending, and if there's any dependent care that you have or dependent things that you have that you can use. Also look at what you're actually spending money on and making sure that you're covering those, so that you're not guesstimating, but you actually have like actual dollar amount. Because of course, if you overestimate and you don't spend it, then you lose that money, and we don't want to do that either. So making sure that you're really taking a look at your year in review. Another thing that, because we are coming up on tax season going in, if you have time at the end of the year, also making it a practice to kind of get your documents in order, so that you're not rushing and trying to, going behind the eight ball when it comes to that, and not forgetting about your investment things as well. All right, so planning your year. So like I said, taking a look at your primary care provider. Kind of think of, I do watch football, so I think of your primary care provider is like your quarterback. They're the ones that kind of navigate everything in terms of your health care. Taking a look and seeing where you're scheduling an appointment, and who your primary care provider is. That's a big part of your advocacy. Making sure, because research does show if your provider looks like you, they tend to have you have a different experience with them. So for me, years ago, before it was like kind of cool to have all Black providers, all my providers except for two are actually all Black. From my dentist to my optometrist, all of them all Black, except for two of my doctors, which is my allergist and my endocrinologist. And I actually have kept them around because of the way that they treat me. They actually listen to me. And in particular, I had a conversation with my endocrinologist really about the way that he practices. And when you look around his office, he actually has a wide variety of people that works with him. And the way that he practices, he makes sure that he's not just throwing medication at you. And he's not, I have hyperthyroidism, and he's been with me for years, and which is another reason why I keep him around, because he does have my history. But one of the things is, with me I was hyper before, and then I converted over to hypo because we did some radioactive stuff. But one of the things is that he doesn't only treat the numbers. So one of the things that you want to do in terms of advocacy wise is having a provider that actually hears what you're saying and listens to you. So in terms of with him, he asks questions, and he doesn't just treat my numbers. He asks me, how are you doing? How are you feeling? And if I have a complaint about anything, he's actually hearing what I'm saying to him, and we're having that dialogue. And he's not just throwing medications at me. And what he also does that I really like is that he actually looks up the medication and says, oh, well, this is going to cost X amount of dollars. He has a person on his team that her responsibility, or part of her responsibility, is looking for ways for you as a patient to save money. So they're looking at what programs are out there to assist you with saving money in terms of the prescription. And if there's a local pharmacy other than like CVS or Walgreens that can get you that medication for free, or not necessarily free, but at a lower cost. And he'll have his team look for that for me. My dad recently went through cancer. He had cancer treatment and had to be there like every week and going through his chemo and radiation. So which meant that he couldn't actually see him on a regular basis. And so he switched over his glucometer to a glucometer that would upload to his practice, and made sure that he kept an eye on him, because he knew that as my dad was going through the stressors of that his blood sugar would change, but he needed to keep a closer eye on him because of that as well. But he also knew that realistically, he couldn't see him as often. So he wanted to make sure that he kept an eye on that. So he has a team that's solely dedicated to looking at the numbers that came in through the glucometer that electronically was uploaded. So he really caters to making sure, because of course we know that diabetes is something that runs within our community, as well as hypertension. And we know how close that he has to monitor that and make sure that he's keeping a close eye on that. So really making sure that he's on top of those things, that really spoke volume to me. So which is why he pretty much continues to be my doctor, because although he's not a Black provider or a doctor of color, he's someone that actually hears what I say and knows what I need. And we had an extensive conversation. He went on like a freedom tour recently as well, or a couple of years ago actually. And he was talking to me about that and his experience with that and what he learned from that, because he knows what I'm doing for my PhD. So he spends time actually getting to know me and hearing what I have to say. And we have those types of dialogues as well. Another thing that we want to make sure that, especially if heart disease runs in your family or you have a family history of it, want to make sure that you're checking in with the cardiologist, and of course a GYN. For some of us that may be out of childbearing age, I know my mom was like, well, I had a hysterectomy. I don't need to see a GYN. You still need to see a GYN. You may not need to see them as often, but you need to make sure that you're checking in with them, because you want to make sure that you are getting your annual pap smear, because you can still have like ovarian cancer and cervical cancer as well. And also your colonoscopies, making sure that we're checking in on that. Ironically, my dad was diagnosed with rectal cancer, and it was not during his 5 years, because they typically tell you every 5 years you want to do your colon cancer. My dad was diagnosed on one of his off years, and he had a pain that he was like, okay, he thought it might have been hemorrhoids. And he had the pain. We went in on that Monday. We got the colonoscopy scheduled for that Friday. And by that following Friday, he was diagnosed with rectal cancer. So very important to keep up with that. And again, like I said, it just happened to be one of his off years that he wasn't supposed to be scheduled until this year, but he was diagnosed last year. Vision question?
Yeah, I do. I wanted to ask, for women who've had hysterectomies, and you said that they should still be seeing their GYN. Talk to me about a pap smear, because I thought, what does a pap smear actually check for? Does it check for ovarian cancer, or is it one of the cancers? I thought it was one of the cancers it doesn't diagnose. Is that right or wrong? Or, like, what does
Yeah,
a
they
pap
will
smear
still
do?
check.
Mhm.
Yeah, they will still collect the cells and can still check for the cells from from different cancers, but they will still make sure that everything is okay. You can still talk about symptoms. There's still also some people that they may not have had the hysterectomy, but they may have some other symptoms that may be going on. There could also be some things like weakness from like bladder weakness, that they may need like a pessary or things like that. So there's other things that, like some people think that, oh, well, it's only because of old age that I might be having it. Oh, I might be having like little bladder leaks and things like that. But it may be something that could possibly be fixed and not necessarily have to walk around and deal with it. So
And then
checking in and making sure.
with the
Mhm.
colonoscopy, right? Because just interesting that you say that your father, they tell you to do it every 5 years if there's a problem, every 10 years otherwise, I think. So what kinds of things should we be looking for? And they also tell you not to do it, I think, until 40. But every now and then I keep hearing about younger people like your
Yeah.
father who got it during the off time. And obviously, it was pretty aggressive. Um, but what about the young people who are getting diagnosed?
Yeah, I think a lot of it, again, my own opinion, I think a lot of it has to do with our diet.
Uh,
If you notice, like, I think a lot of our issues issues right about now has a lot to do with our diet. I think that's like the common denominator, because when you look at just how it's almost been like an influx of things happening across socioeconomic, even some races as well, that it's just running rampant everywhere. So some of the things to look for is like change in bowel movements, change, and like in his case, it was a pain. He had a pain that he couldn't really describe to me. Again, he was also had open heart surgery at that point as well. He had a pain that he couldn't describe to me. And for me, when he starts trying to describe something, it's easier for me to just take him in and say, all right, let's go. And I do my own assessment, and then I start going by the specialties and saying, okay, based on, but of course I'm a nurse, so I can do my assessment on him to say which specialty we're going to start with. But for someone else that may not be in the medical field, start with your primary care provider and try to, at the best, kind of say what the symptoms are. And the big thing I would say is to take notes on when are you feeling this way after I eat a particular thing, or if I feel, sluggish, like a lot of things, if, it may not be a rhyme or reason, but you notice like a coincidence, it may not be anything, but it may be something you don't know, but just take note of it and write it down. Because a lot of times we think our memory will remember it, but once you get in there with the doctor, so many things that you have to remember, you're not going to remember it. So just write it down and kind of keep a log is another thing that I would recommend, is keeping a log of the things. For him, I have on my, for those of you, I'm sure Android has a notes app. I have a notes app for him. In my notes app, I have a notes section just for him with all his notes for all his doctors. So I can go in there and I take notes for every doctor's appointment. And even before this, I had started going with him to the doctor like earlier that year. So I can go back and pull something that a doctor said or something that happened at a doctor's appointment, and I can pull it at that very moment, real time, and say, oh yeah, this is what happened and this is what the doctor said. So that way you can kind of have a record all in one spot and not having to rely on your memory.
Hi, can I say something? I'm sorry, this is Sandra.
Yes.
Helen knows this, but I live with a rare muscle disease. It's called late onset Pompe disease. It's under the umbrella of muscular dystrophy. I'm 60. Okay. I was diagnosed when I was 53. But I was dealing with symptoms it took them about 10 years to diagnose me. So I'm very familiar with self-advocacy. What you said about notes, my doctors are amazed because I think I have, and you should, I have more information about what's going on with me than they do. Anytime they need something, they come to me. I even write my own letters for, doctor, what do you call it? When you need a letter of medical necessity. Right. My doctor signs them and sends them back to me. So what's also important, I think, that comes in handy is, like I use Virtua, as far as my care team, and I use I just changed doctors, I'm sorry, over in Philly. I can't think of the name of the hospital. But anyway, my doctors are in South Jersey and Philly. I used to use a doctor in Mount Sinai in New York, but it just became too much for me to travel back and forth. So I use their online portals. I believe in them. They're very helpful. I always, I communicate with my doctor through them. I get my those, the assessment after you had a visit. Download those onto my computer. That's how I keep meticulous records. I just saw my primary care. I had a sheet, all of my medications, because they still ask you the same questions all over again about your medications. Has anything changed? And I also have my questions for her because, again, like you said, you may forget. So I write everything down. What do I need? I get my, my vaccines and then, my blood work slips or whatever. And it's a job. And every 6 months, I'm inundated with doctor's appointments. But I think that if you're very meticulous and organized, it's, easy in, easy out. So.
Right. And I think that also adds to, I think that adds to the advocacy piece of it, because when they see that you're that prepared, I think that's her point, is that when they see that you're that prepared, it makes them that much more on top of their game when it comes to dealing with you. Because when you're able to thumb through and say, oh no, well, on this date you said da 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 da, or
Yep.
we've tried this medication and that one, it gave me this side effect. You're now part of the healthcare team, because you are supposed to be part of the healthcare team.
Yeah.
That's the part that they don't necessarily share with you. You are part of the healthcare
Yes,
team.
absolutely.
You are one of the members. So you have to be completely versed in what is going on, because they practice medicine, but you know what's actually going on.
That's
and you're
right.
supposed to be that much more knowledgeable about what's going on, because you have the actual research, because they've done it on you. So you know what actually has worked, what doesn't work, which dosage have worked,
Yep.
like, again, that endocrinologist, we will tweak, because I didn't particularly do well with the synthetic, with the generic form of whichever medication it was I started out with. I forgot the name of it right now, but I didn't do well with the generic form. And he's like, you know what? But he also, that particular doctor does a lot of research. He's involved in a lot of research. So like, for example, a lot of these the weight loss drugs that's coming out now, he was actually doing research on it, like,
Wow.
like during COVID. And so it was actually stuff that he was finding out and discovering before all of this. And he can tell me, like, oh yeah, they're going to come out and they're going to say this. And sure enough, within a couple of months, you start hearing it in the news, because he's one of like 10 doctors that's working on XYZ. But you have to be part of the team. And if you know your stuff and you're walking in there with your stuff,
Yep.
it's that much harder for them to kind of say they perk up and they pay attention a little bit more. Because when I go ahead.
So Kerry Ann, what's your recommendation when we have doctors that don't want who resent or resist the patient taking a role in their own care? Because
Get a new doctor.
So my stance on that is, you pay your health insurance, so therefore you decide that that's not the doctor for you.
Yes.
So, and again, like I said, I have a 23-year-old son. My son has a lot of health issues as well. And he was telling me how he went to the neurologist and he was kind of dismissing. He's just throwing medications at him. And he's like, well, he's not really listening to me, Mom. I was like, no, I pay the insurance. So therefore, if you're not getting what you need, he needs to be fired. We need to move on to another doctor that's going to hear what you're saying. And that's just the only way that you're going to be able to do that. And another thing is that a lot of times, I know we get inundated with surveys and we think that the surveys is just, oh, here we go again, another survey. But that's the only way that we can actually make the change. So do the survey and find another doctor. Because a lot of times the surveys.
Because I think some people are, first of all, my concern is Black people, and it might not just be a Black thing, but we're talking about us, is that many of us are just trusting of these people because they're the doctor, they're the lawyer, they're the whatever, and we're not comfortable questioning. And because of HIPAA, now you can't even, unless your mom gives you permission, or your parent or your child even, who's of age, right? You may not know what the doctor is telling them if your parent or whoever doesn't want you to know. So advocacy becomes more of a challenge because you're dealing with the unknown and trying, and I'm going to say elderly people, but I don't even think it's just elderly people. I just think some of us in general, we just believe what the doctor says. I was not even 40 and this doctor's describing a procedure to me. He was a new GYN that I went to see because I changed medical programs, and a friend of mine told me her doctor. So I went. I didn't know him from Adam. I did not tell him that I didn't want children, even though I didn't, but I was on the birth control pill. He didn't ask me anything. And he starts I'm 39, maybe 38-ish or something, going into, close to 40. And he starts describing a procedure. And of course, I know he's talking about a tubal. And I'm like, thinking to myself, and the scary thing is that this was a white doctor in DC. And he was at, what was that women's hospital? They're gone now, but that's all their specialty was women. And he was a doctor there. I no more needed a tubal ligation than, and I'm just thinking how many women, and I had did some letters behind my name, and still he insulted my intelligence to tell me that I needed all this. And I just think, like, how many women went into his office and got a tubal ligation or whatever that he suggested without questioning it. So, and I know that's a big question for you, but I just want people to understand that it's your body. And if you're not comfortable, and stop trusting. But anyway, go ahead. What is your take on that? It's just bad.
Yes, I think that I think especially if it's a complex issue that you've been dealing with for a significant amount of time, that it seems like they just can't seem to put their finger on it, that there's no reason why you should not go to the doctor with someone. I think buddy care, if you want to call it that, is something that you should be doing. A trusted friend goes a long way. Number one, not their strength in numbers is one thing, but number two, that friend is not only there for support, but that friend is also there to hear some of the things that you may not be hearing. That friend is also there to kind of help you to kind of navigate that space. And then also, because it's hard to kind of take in everything because when I go for myself, it's hard to keep track of hearing, talking, taking notes for myself as well. So having someone there just to kind of go through that, and then depending on the severity of what it is that we're talking about, it's difficult. It's hard to process those things. The mental health part of it is hard. So I think that it's not something that we should take lightly. And I know a lot of times as Black people or even Black women, we have this, we have to be strong. We have to do all these things, and we have our capes on, and yes, but it's hard. So I think having someone else with us is very important, because we're carrying the weight of our families, whatever our families look like, whether it's husband, boyfriend, significant other, parents, we're carrying it all. Children, stepchildren, auntie, sister, cousin, play cousins, whatever, but we're carrying the weight of everyone else. So we have to be able to kind of make sure that we're taking care of everyone in the village all together, so that we're not going to the doctor by ourselves. And so that they see that I'm part of a community, number one, and that I mean something to a community. And another important thing is to make sure that we have our documents in order. I have a healthcare surrogate documents, and I also actually in January, the first week of January, I'm taking care of my parents' documents. I did estate planning for myself, and I make sure that my parents also have it. My partner's, his parents, we're making sure, because his mom recently had a stroke. So we're making sure that he has the documents for his parents as well. So it just makes life a little bit easier. And one of the things, with my son having the health challenges that he has, making sure that, those of us that have older children, when they're going off to college, that's something that we should also consider that we should have. Because when I go with my son to his doctor's appointments, making sure that those doctors know, like, hey, I'm here. There's times when my son is admitted to the hospital in Orlando, and I'll call and I'll talk to the charge nurse, like, hey, and I'll put them on notice. Don't play with this one. And I need them to know that, yes, his mother, I am 2 hours away, and I'm on my way, because I've had to check them and I've had to advocate for him when he's not able to, because of how bad he feels. But, imagine, young 23-year-old African-American man coming in saying he's in pain. They automatically think, oh, wait a minute, drug seeking and things like that. because there is, there's bias in healthcare, and we have to realize that there is, and make sure that we're having those documents in place so that we can then stand up and speak for them as well.
That's important.
And it does cost money to do that. So we do have to make sure that we have our ducks in a row to make sure that we have that, but it's invaluable to have that in place.
Okay.
All right. And then dermatology is also something that we want to look at as well. And dental and vision will sometimes let them know what are some of the things in terms of hypertension and diabetes. Sometimes they'll be the ones that'll actually diagnose your hypertension and diabetes as opposed to the other way around. And then dermatology, you want to make sure that you check in with dermatology because we also do have some skin conditions that may go ignored or things like that. And you want to make sure that they are also assessing that. And then endocrinology, I touched on that. They are the ones that take care of your diabetes and some hormonal things as well. And mental health is definitely something that we want to check in with and make sure that we are getting our emotional health in order. Because ironically, sometimes, depending on what our traumas are or what our mental health and emotional health looks like, it could potentially wreak havoc on our entire body, and we don't know where the pain is coming from, and it's really emotional health that's interfering with it. All right, and then I told you again, showed you before, take a look at your benefit package and seeing, let me just move this out of the way. All right, so take a look at your benefits package, especially at the beginning of the year, because we're going to pay a little bit more, depending if you have deductibles, not knowing what your deductibles are. If it hasn't been met yet, some of your insurances will not allow for your healthcare provider to prescribe certain medications if it's within a certain particular tier. They'll have to go through like one particular tier first before trying another one. So making sure you're speaking with your doctor, your healthcare provider when prescribing, seeing if there's any alternative, asking, especially if it's a newer medication. There's a lot of new medications that's on the market now that a lot of doctors are saying, hey, try this out. You can ask them for some samples first to see if it works for you. One of my dad's doctors, he just gave him 2 different dosages and say, hey, try this and see if it works. Try this one first. See if that works. If it doesn't, then try the other dosage, see which one you like better. If they do work, then at that point, we can call it in and see how much your insurance is gonna, if your insurance covers it. If it doesn't cover it, you can take a look at the Canadian pharmacy. So a lot of the doctors now are kind of getting hip to the game, like, you know what, we are not, I guess they're like doing like a soft boycott on the American insurance industry. But he recommended take a look at the Canadian pharmacy to seeing if he could get the prescription there. There's also manufacturer programs that you can look at if that particular manufacturer has programs. Some of them are income-based, but some of them are not, depending on the prescription and depending on if it's a newer drug. The only thing that sometimes it's a limited time that they'll offer that. You can also look at something like Good RX or Prescription Hope or like a neighborhood pharmacy. And those are also some other options that you can take a look at. And then, of course, everything ties back to money. So if you, again, like I mentioned before, there's a question. As I mentioned before, the surveys, if you are completing the surveys, especially if you went like inpatient at the hospital, those surveys usually are tied to dollars. So if you had an experience that is undesirable, definitely complete it. If you had an experience that is a good experience, you also want to complete it. But they're actually linking the surveys now to the reimbursements. Also, if you get, like, let's say you got discharged for something and then you get readmitted within the 30-day period, that is also being connected back to the money and the reimbursement. So they are really trying to really tap into like the monetary part of it and taking a look at how that impacts the healthcare provider as well. Unfortunately, I know like within the maternal space, there have been providers that have done some awful things and have had some deaths, and they are still practicing. And, it's just really doing your due diligence to really research the provider and making sure that they are, they have a good reviews, and that they're having, good outcomes and things like that. I know in terms of like the birthing space, there's an app called the Earth app. It's birth without the B. They dropped the B for bias. She's actually using that to where people can go on there and kind of review their experience with their providers and their hospitals. And they're able to, we're kind of using that to kind of get the word out of how people are being treated in that sense. And then, like
There's
I said,
a
the
question
advocacy.
here, Kerry Ann, it says,
Yes.
two of them, they're talking about the can you see the chats? No? There's two. One says, what do you mean by reimbursements? And the other says, please discuss further how the surveys and reimbursements are connected.
Right. So if they don't score a certain amount or score on the surveys, they will get they won't get like the full reimbursement on the survey. And then that's pretty much what will happen in terms of the surveys. They're connecting the responses on the surveys. And in terms of just the hospitals, though, not necessarily the doctor's offices. It hasn't gotten that far yet. But more so the hospitals and the ones that are under like the Health and Human Services. And so they're using that as like a way of kind of deterring the poor treatments, I guess you can call it, that some people are receiving. And if you're not familiar with the Kira Johnson's story out of Cedars-Sinai out of California, they actually had a lawsuit against Cedars-Sinai that actually, because of the treatment that she received, and they noted that that is actually directly related to how Black women are being treated at that particular hospital. So there's an actual suit against that. So they're trying to tie the monetary reimbursement to that to try to deter how people are being treated based on those surveys. But the only way to tie it to it is for people to actually respond to the surveys. And what was the second one?
To just explain how the surveys are connected. I think somebody did already. How the surveys are connected to the reimbursement. I think Dr. Lewis answered that. Reimbursement, what is paid now. So how did you talk about it being connected to the survey? The reimbursement?
Yeah,
I think you answered it because Judy, she's seeing the answer because she's saying I would definitely complete my survey now.
Yeah, because a lot of times we think that, oh, okay, they don't really, it's like, I don't feel like doing it. But it wasn't. I actually took a class and I was like, oh, wait a minute. It is actually tied to it and connected. And when you actually follow the money and the reimbursements and all of that, it is all connected. So yeah, it's actually connected. But we have to actually do the surveys. So
excuse me, somebody just put in the chat that there's a probability of being blackballed if you return a negative survey.
No, because they don't have a way of actually, they don't have a way of linking it to you.
They can tell from my IP.
Do you think they got time to do that with all them people?
I don't know, with AI and everything, I think they could do whatever they want to do.
No, they don't know. I don't know. That's a lot. That for them to do that, I would rather return the survey and listen. Yeah, I would return the survey.
Okay.
Because if they got time to do all of that, they got time to train the nurses and the doctors to treat people better. Use the time wisely. Yeah, I would. Yeah, yeah. So I would not let that deter me from, if you treat me bad, you treat me bad. But because the thing about it is, if no one says anything, that could be 2 patients down the line. And then somebody say, oh yeah, you know what? That did happen to me. And I never said anything. And then now here it is, someone actually has lost their life because I never said anything. So I think that we have a moral responsibility to each other to actually speak up when something is wrong. And I mean, they blackball you from not going back to that hospital. They doing you a favor. Like,
Right.
I don't know. I mean, they can't really blackball you from what? You know, there's this professor named Dr. Chin, Dr. Peggy Chin, this white lady actually, out of San Diego, and she writes about emancipatory knowing. And I happened to be on a lecture with her the other day, about 2 months ago, and we were talking about, because I live in Florida, and we were talking about all the stuff going on in Florida and how he's trying to force all of us to do all these different things, and we can't say Black, we can't say this, we can't say that, we can't do that. And she said, you just have to be comfortable going to jail. She said, that's pretty much it. And I was like, what? And because she said that back when, and I want to say this was like in the 60s, she was having meetings or this like collective that she was doing back in the 60s on Sundays. And she was meeting with a group of white women on Sundays and talking about basically all the things that's going on now. And she was like, and we were meeting in the 60s, and why are we still having to meet now? And she said, we just have to get comfortable with going to jail. She said, they can't arrest everybody. And that was based on the question that I asked her about being here in Florida and what are some things that, because I also teach, I was a TA, and it's just like, well, they have all these like forbidden words that you can say. And she said, no, this is crazy. So I guess that's my answer. It's like, they're gonna blackball you from what? Going to that hospital that treated you bad anyway? So I don't know what the right answer is, but I do the survey.
I wonder if we have a Black doctor who is not up to par. As a culture, we tend to protect one another. So do we, now I know what I would do. Well, I shouldn't say that, because I've had a bad Black doctor. I bad-mouthed her, but I didn't do an official complaint on her, but I let it be known with her colleagues. But do we tend to protect the bad doctor, or do we report the bad doctor? I mean, not what should we do, but what do you hear of us doing that, or we just move on and go? Or do we say, I want to know more Black doctors? Because we do that too, which is stupid. But
well, I think the reality, hang on one second, Aaron, bring me that, please. Don't you about to, no, thank you. I think that a lot of the thing that we have to also remember is that the Black doctors, they're also socialized within this capitalistic white supremacist society. So that's the reality of it. So not all Black doctors are created equal. And so not all of them are going to have the same moral compass that we may have. And so you do have to kind of take that with the into consideration, because for example, the one that was just that just basically had the horrific birth outcome in Georgia, there was a Black doctor. But also those nurses stood back and allowed her to do what she did. So, you know, at the end of the day, I know that nurses will always say like all the weight falls on us, and it does. But one of our tenets, or one of the things that we took an oath on, is to advocate for our patients and to stand up for our patients, even when the doctor is doing what they're not supposed to be doing. So yeah, it's a harsh battle and a balance to take, but you do also have to call that doctor out, because if it's wrong, it's wrong. It doesn't matter if it's the same color as me. Is you wrong, you wrong.
Absolutely.
And
like you said,
I have
it's
to
the next
stand on
patient.
principle.
It's not just about me, it's
Right.
about looking out, advocating for, you know, as a community, we're advocating for the next patient. There's a lot of questions here about what's the best way to find, do you recommend that people find? And Dr. Lewis, if you want to jump in and give some of your insight, it's much appreciated.
I just wanted to make a quick comment in reference, because this whole conversation around advocacy is really powerful. And just this is my first time with you guys, by the way. So
welcome. Yeah.
I'm actually a naturopathic and functional medicine doctor in New Jersey. And so I want to, and my support is for people all over, because there's not someone with my level of expertise in everybody's backyard, right? So what I wanted to just mention in reference to advocacy, because I deal with my patients, as well as I have two parents that are in their 80s, and there's just a lot going on when it comes to advocating for ourselves and advocating for the people we love. And what I just wanted to mention is that to add to that team, right, the second opinions, the third opinions, like all the things that have to do with advocating for even deeper care. Most people are showing up to someone like me because they may not have had the experience that they need with their practitioner, or say they want to go deeper. They want to understand why, the root cause. They want to try to get off their meds, or whatever the scenario is. So I end up being the advocate for them with their practitioner, and or supporting them with going deeper in their care. So you may want to consider, if you're not getting the outcomes, right, you may get the same type of experience because you're staying within that system, but you also want to look at other ways of support, right? You want to look at nutritionists, and you want to look at other ways to be able to get to the root cause, or to treat or to support those other challenges, because you may not always get them within the system. So I just wanted to make that clear. The second thing is that from even marketing and all of that, I always talk to people about SEO, or search engine optimization, when it relates to like trying to make sure your website can state, I'm a Black doctor, right? Because that's the first thing that my patients say to me when they, especially Black women, they're like, I want a Black female doctor. I've been looking for a Black female doctor, and I don't know really how. They don't allow us to put that in Google. Like Google won't let us put, search for a Black doctor, whatever. It's crazy, right? So what you have to do is put it inside your profile. So if you want somebody to find you, you put it inside your social media profile, or you put, African, I put African-American, Black, all over the website, right? In multiple pages, so that as soon as somebody types Black or African-American in, it'll pop up naturally. It'll pop up by natural search. So a lot of doctors don't know that because they don't understand maybe the internet marketing side of things. But Google and Facebook and all those are they are just clamping down on being able to use Black and African American and race and all that kind of stuff that and which is a shame because you need to find someone who looks like you, who supports you, who understands the nuances of your life, right? It's so important who you, if you can find somebody in that specialty who really understands and knows you at the core of who you are, because the cause isn't always the physical. The cause can be the stress. The cause can be the things that are going on in your world. The cause can be the financial issues. The cause can be all these other things that can't be controlled or managed by a drug, right? And if that doctor doesn't understand that, then they're pushing you down one route when the issue is all the way over here, right? And so you know, of course, you won't get better as quickly, but you may not even, you know, the treatment plan may not even be the best process and treatment for you. So it's so important to just keep going down. Like, even if that person doesn't show when you Google search, they don't show up on the first page, keep going to the second page, the third page, the fourth page, the fifth page, click all over their websites, click to find a picture, search for them on social media. You know, you can look for on LinkedIn, you can Facebook, you know, Twitter, any way you can possibly find to find out who they are and what they represent. And just keep doing that, you know, that deep search, because unfortunately the search engines really don't.
So let me be naive for a minute. What is the rationale behind not allowing any, you know, I'm an Asian doctor, I'm a Black doctor, particularly Black
Because
doctor.
they know, that they give them better care.
Yeah,
So
yeah. So one of the I don't even I
another
don't know
thorough
if
plan.
it's I think it's more of the search engines and the social media just having control, you know, controlling, because
Control.
remember there was this whole issue around race a few years ago that bubbled up to the surface when during the pandemic, when everybody was out marching, right? And the whole everything just went, you know, to hell in a handbasket for in their perspective. But we were like Black Lives Matter, right? And so so for us it was important, for them it was a nuisance, right? So what ended up happening, especially on Facebook, where we were able to target, so I can run ads and do all those things on the back of these platforms, even on Google, on the back of the platforms, they stopped us from being able stop people from being able to target people based on race and target people based on income. And they pulled all these restrictions back, also because you have to remember social media also got in trouble, or quote unquote got in trouble, for all that issues with Trump and allowing the Russians and the Chinese or whatever to hack into social media and try and have an effect on the election results and all that kind of stuff. So there's just a lot of trying to clamp down on the search engines and social media in reference to things they would consider sensitive issues or sensitive, and they consider race,
That's crazy.
which is
All
crazy.
right. So we'll circle back with you. Go ahead, Miss Kerry Ann. We just all in the middle of your presentation.
So yes,
Oh, no.
I just wanted to.
No. That's all good stuff. Because I was gonna say that the other part of it is don't forget about some of the local, like here we have like the medical society, the T. Lee Rowe Jefferson Medical Society, and that's like all the Black doctors are part of that medical society. So I can easily, usually I'll text her like, hey, I need a Black doctor that is a specialist in whatever, and she'll give it to me, because usually people will come to me and say, hey, I need a doctor. Do you have a Black doctor that does whatever? And that's usually how I get it as well. So check out like whatever in your local area, that if you have like a medical society, that's usually like the Black doctors. Another thing that I did, like with my son when he was looking for the neurologist, I looked at where they went to school. It's not always a guarantee, but you know, like his primary care doctor went to Morehouse. The neurologist that we were looking for, she went to Meharry. So like kind of looking like at the school, that's usually something, and then doing a reverse Google, like you said, getting on LinkedIn and looking for the name that way, or going, you know, like a reverse search if you can like get a picture on like sometimes on the if you do like a search for them on their particular website, there may be a picture on the like pediatric associates of whatever, and it'll be a picture of them on there. So it takes a little bit of work, but
Worth it.
it's worth doing
Yeah.
the work.
We have another
to get
hand. Do you want to keep talking or you want to
Yes,
take the
Lenny.
question? Take the question,
No, go ahead, Lenny. Mhm.
Lenny?
Yeah, I was just gonna say, my daughter has her face on her what you call her associates, so it's obvious who she is. But if you control your own website, you can put your African American heritage in your meta tags, so see them that way. Another way, which is sort of sneaky, but you can join an African American or whatever you want to call it group. It doesn't have to exist. It could be a African American mutual benefit group in your group as a social group, and that way it would show up in a search.
Okay.
Yep.
Thank you, Lenny. Go ahead, Kerry Ann.
So, and then the other thing was taking a look at the patient bill of rights, knowing your bill of rights. Some of the providers, they will kind of have that information there. It'll tell you at the bottom where you can file a complaint. Again, you know, whether or not you want to file the complaint, whether you're going to be blackballed or however you want to consider it. Again, you do have that right to file a complaint and, you know, and go from there. But it will tell you at the bottom where you can actually file a complaint. And like I said, do the survey, and the Health and Human Services, if you go to their website, it will actually tell you how to file a complaint on that website as well. And like Dr. Lewis said, I'm like, what was the name again? Dr. Lewis said that, like I mentioned before, the mental health piece of it, that sometimes is an issue. And then a lot of times the getting with a doctor such as Dr. Lewis, I know like we were actually just having this conversation. Someone was talking to me at work and saying that, you know, they just can't seem to pin down like what the actual issue is. And sometimes it's not covered by insurance, but that's where you can actually use some of those extra dollars that you have, not extra, but using some of those benefits, your FSA dollars that you have, that it may not be covered by your health benefit part of it, but it will be covered by that portion. You can use some of those dollars to cover a provider like that. That will actually get to the root of the problem and really do some of the extra tests that you can have done, that it's not your typical blood work that can get to, you know, some of the other issues that you may be having, and really look at you holistically and get to the root of the problem. And in terms of prenatal, oh, go ahead.
I'm sorry, could you repeat? You said instead of using your insurance, you could use something else, and I missed what you said you could use.
Right, because you have like other dollars that you can use. So not like your benefits, like your medical benefits, but you have like dollars that you can put away, and you get like a savings card that you can use those dollars to pay for services like that.
Okay.
Depending on your plan. So you just have to make sure that your plan actually covers that.
Thanks.
Because it comes under health. So as long as it comes under health, usually you can use that. And it's like a credit card that you have that you can use for, like, for example, if you were go get like anything health related, you can use it for that.
Actually not making sense.
So you have your FSA dollars. It's dollars that you have that's part of your benefits package, but it's not your medical portion of your insurance. So you wouldn't necessarily give her your medical card to use. So she wouldn't take your insurance card because it's usually not covered by it's not covered by your health insurance, but it will be used for like your actual health, because it's health related. You can use your dollars that you get from your benefits from your insurance, but it's not like a medical insurance.
I don't know what
You
you're talking
got
about.
that? Okay, well, get with your employer, and you usually have dollars that you can use if your benefit package includes that. But you would have like a credit card that you would have dollars that they put on that, and then anything up to like $3,000 that's related to anything health-wise, you can use that. So let's say that her initial visit is like $400. You can use $3,000 out of that $3,000. You can use $400 out of that $3,000, and she'll take that credit card, and you won't necessarily have to use your personal money, but it'll be money that's out of that bank of money that you have. But it's out of your benefits package. But you'd have to get with your HR to find out if you have that benefit available to you. It's a health savings plan.
Yeah, I don't know that everybody has that.
Right. So just check with your provider, to your employer, to see if you have that. And if you do, great. If you don't, sorry, but you'll have to pay out of pocket.
Yeah. Can you talk a little bit more about, because one of the big ways that I see that we can advocate for ourselves, let me let you do your closing. I see you put up that lovely picture with your thank you. So.
Well, no, go ahead with your question.
Okay. So, no, thank you. I love the information. Let me stop sharing and then we can just see who's on screen and who wants to jump in. No, but one of the things that I've learned the hard way, and I want to stop the sharing. I'm trying to stop your share. Okay, there you go. Oops, Kerry Ann. Oh,
yep, I'm here.
All right, I thought I knocked myself out. So one of the things that I learned the hard way, or I should say hard way, it's just good information to have. And I wonder how many people on this call, because I think Sandra mentioned it, how many people are checking your portal? Because a doctor can tell you whatever they want. And before we kind of had to believe them, but how many of us are actually checking our portals? And I spoke with a friend the other night when I was, talking to her about this call, and she was saying that her doctor had put something in the portal that it didn't happen the way that she discussed it, and told her that in the record it said that she had been diagnosed with something or whatever. None of this had ever been conveyed. So, and I just want to know if we can get a show of hands or just like say something. Are you all checking your portal? Do you all know what a portal is? Anybody got any feedback? I'm going to bring you on screen, Dr. Lewis, since you're here. I'm going to take advantage of you.
Yes, use that portal, and you can actually link family members. So like my dad's portal, I have my dad's portal connected to mine, so I can actually toggle between mine and his, so I can see his as well.
See, now that I didn't. So you have to, so that's a HIPAA thing that he would have to sign off on.
Yeah.
I saw a few hands that go up. Is there anybody here who was not familiar with their portal before? I'm sure, hopefully before today, but does everybody know what a portal is? I guess what I really want to know. Because
I
the
do.
advantage of it is
That portal is not just good for that information, because I tell you, you won't believe how many times that the record, the information about the office visit and diagnosis and things like that are incorrect, but also your labs. So everything that you receive, every contact, everything that you believe is important about your care, if it's inside that portal, get it, right? Get it, download it, put it in a file, save it on your computer or wherever. Because you also wouldn't believe how many times, not just the diagnosis, but also labs might not be interpreted effectively. Like, so there's a lot of things. And of course you're like, well, how would I know? Because I don't know how to read all my labs. But there's sometimes there's things that are glaring, right? Like they're like, oh, my blood sugar is 127. They haven't really talked to me about doing anything about my diabetes. And that's, if that's diagnostic range, maybe they were like, oh, we'll talk about it in the next visit, and never mentioned it during that visit, right? And so now you're waiting a whole year or 6 months or how long it is before that next visit for them to bring that up again, right? Or your symptoms start to show up. So you want to always, inside that portal, you want to download your labs, download your notes, download everything, read everything, just be as diligent as possible, because it can save you so much time, energy, and
so I think the two key learnings that we getting from this is one, I know when because I just don't trust all this, everything being online. I just think confidentiality is out the window. So I'm usually the one that's resisting, like, no, I don't want to be in your portal. But recognizing now that it's your way to keep your doctor on point. So when you go in there, they know that you've been reading your portal. Oh, I think you're going to have a different experience. But for the rest of us, I want us to also recognize what I think Kerry Ann said that's very important, because I think a lot of us have parents who are, they don't want you in for whatever. People aren't comfortable with having other people knowing their medical information. But this is one way that we can maybe convince mom or dad, like, let me be, is it a cosigner? What are they called on the port? If I'm on my dad's portal, what am I called?
well,
Oh,
yeah, I just log in as her. I mean, I just, I know, I probably shouldn't say that, but,
I log in as him, but they know when because usually I'll just sign it as
Right.
Kerry Ann
right.
on behalf of. They know it's me
Yeah,
because they know he's not logging in there.
because how many older patients and our parents even know how to navigate online, right?
Right.
So a lot of doctors have gone solely online, and they're having to come to us to be able to say, oh, I needed access to whatever, but I can't get access to it because it's online and I don't know how to get online. Right? And so it's a catch-22, because it's going to be up there anyway, right? If they have a portal, it's on that portal. So you might as well get as much information as you can, but also to know that this is the way of the future, right? It's not going away. It is what it is, right? And so just getting comfortable with it, but having access. Before, you had to go to the doctor's office, or you had to go to the hospital, sign a form, say, I need my records, wait days for your records. It was so much more difficult. Now it's at a snap of a button. So
Right. And then the thing also, the other thing is that you can also message your provider. So rather than sitting on hold, waiting for them to call you back, and send them a message. If I need a refill, or, or if I have a question about something, or like in his case, he might need a refill of a sample. Hey, we need refills on a sample. Okay, here you go. You can pick it up. We got some in.
schedule appointment. There's a lot of different things.
You can do appointments on there. Yeah, lots of things. Lots of convenience.
Just now, I moving to Florida and knowing that I had the portal from my New Jersey office. I didn't even have, how if you want a copy of your records, send us a signed this or whatever. I was just able to go to my portal and print whatever was out there and show it to my current doctor. So it definitely is an advantage. And I'm definitely old school and I resisted it because I'm still not accepting AI. So
Right. But we walk around with smartphones, so
yeah, but the phone is only as smart as the user. I'm not very smart. But well, we got two hands up. Go ahead, DeAndrea, and then Judy.
Hello, ladies. Thank you for being on the call. Sorry I'm late, by the way. In terms of just the usage of the portal, I think the healthcare industry, or at least the medical industry, I think they should maybe fund time to the doctors and providers to their patients and educating them on how to properly use the portals, or at least have a significant other, or like a companion or something like that, to teach them how to use it, or in some cases have someone that's tech savvy that will teach them in a patient and subdued, non what's the word, non like
non-threatening.
non-threatening problem. I had another word, but that actually sounds better. And it would be easy for them, and it doesn't even have to be a whole like big smartphone thing. It doesn't have to be something you only use for the newest ones. It should be something that helps them navigate through it without feeling nervous if they press a certain button. And for me, I'm a younger generation. I'm in my mid 30s, and I'm just like, I but I understand the concept of having your personal information in a portal to being kind of open for anyone to read, because anyone can easily hack into something.
Yeah.
And having that information out on the world, and having I don't trust AI for my own reasons.
Yeah. It's
But
very nerve-wracking because, and that's a part of that was my reluctance. When I moved from New Jersey to Florida, it doesn't for instance, you're only supposed to have a colonoscopy every 5 years. And I'd be like, well, I'm in a whole nother state. They won't know. Yeah, they do know. It's all connected. So it's very big brotherish,
yeah,
and I don't like it. So that was part of my reason for not wanting to be involved. But once you're in it and you see the event, but still, I don't trust it. And you know what? I also accept that we don't have anything called privacy anymore. So
we
anything,
lost that for a
all
while.
this shredding papers, and
Long
I don't
time.
do any of that. Because if anybody wants to know
Yeah.
anything about you, it's so
Well,
anyway, thank you, DeAndrea.
oh well,
So
I'm
And
sorry.
I just wanted to say something really quickly about Deandra's comment.
Yeah.
What I
yeah,
like to do, because a lot of the work that I do is virtual. But what I always like to do is take that comment that you made and say, let me figure out how I can solve that. Maybe we won't have manpower. Maybe the medical industry is not going to do it. So I'll go in and I'll create videos and I'll create things that are onboarding and support for people. So I'll say, okay, as soon as you become a patient, here's what then you'll start getting these emails, or you'll start getting interaction, or my assistant will say, okay, let me start walking you through that. And that's
Yeah,
going to be a practitioner.
Love it.
It's going to be a practice by practice type of experience.
yeah,
And so
Love it.
I would ask my practitioner to do that. I would say, hey, I had a challenge with X, Y, and Z. I think this might be a challenge for the rest of your patients. Why don't you consider doing A, B, and C? And I think they'd appreciate that.
that's exactly what I was trying to
right.
get at. That's exactly it. Thank you, Dr. Lewis.
Yeah. And again, that endocrinologist, he has somebody that comes out and she walks you right through it and she shows you how to use it. And it's actually a different person that the one that does the upload with the glucometer, it's a separate person that does that part. So and when I tell you that office got it covered, he got it covered. So it really just depends on your provider. But I would challenge them to get you the help that you need.
Right.
Thank you.
Go ahead, Judy.
Yeah, I think a number of people sort of put some of this stuff in the chat about checking it because there possibly mistakes, and in a lot of cases, lots of mistakes in there. I almost believe that sometimes they put stuff in there so they could charge more for their services. I mean, I recently saw my ENT. He did not check all of the things that he had an entire paragraph of all of these tests that he did in my record. And sometimes I wonder, well, is that a mistake, or did he cut and paste somebody else's stuff into my stuff? But I do find quite a bit of errors. I mean, at one point, I mean, I have children, I've had miscarriages. And at one point, somebody wrote in there, she's never had sex.
Oh, gosh, yeah.
And, you know, and there are points where I'm listed as male. So there are lots of errors in there, and folks need to check. Now, I'm not sure how easy it is for some of the stuff to be taken off. And maybe you could talk about that.
Well, I had a situation where a doctor, you know, he just assumed, I guess, because I weigh more than I should, and I'm a Black woman, and he just assumed that I had diabetes, I guess. I don't have diabetes. And when I got a copy of my records, because I didn't like his bedside manner, I couldn't believe it. I could not believe it. I never told him I had I'm like, no, you look in my eyes and notice that I have diabetes. And I had just had a physical, and I still don't have diabetes. But and I didn't give up until they removed it. And when I told them I was an attorney, of course, then they think you're getting ready to sue them. Because at first they said it was nothing they could do. I said, I'll be damned. This is my medical record. Oh yeah, there's something you can do. And about that time is when you drop the L word, and you get, which is lawyer. But I shouldn't even have to do that, you know. And they're just so I was in Camden, inner city. So they're thinking, you know, ignorant, Black, poor, I don't know what they think, but they think that they don't have to, so we have to hold these doctors accountable.
Yeah, right, because that impacts life insurance policies and whether you get this tier or that tier and all of that. Like, so yeah, as soon as you see it, because you never know.
Yeah, it makes a difference. Linda Carter.
Hey, can you hear me?
Yeah, we hear you.
Okay, I'm in the car. I'm not driving though, I'm parked. Okay, first of all, I came in on this portal conversation. I don't know what the heck you talk about portal. And you know how I am about my privacy.
Dr. Lewis is going to educate you because you invited her here today. Thank you, Linda.
Hey, okay, cool. So the other thing is, I guess, Helen, why don't you just have a session on how, or unless the portals are different based on the provider, blah, blah, blah. But if there's a uniform system, how about we just do a session on the portal so everybody knows that, you know, the offer is as a session or part of a session one time. So it's not, at least from, you know, this point of view, those who've been in touch with you will have some idea, because I didn't know. Now I got to go check because I don't like people having information about me. Yeah, that was interesting. Thank you so much for that information. But are they uniform? Are they different? Anybody can answer.
They're all different because we're all different insurance companies.
Okay.
And they're all different doctors.
That's probably on purpose. Okay.
Yeah.
But at the end of the day, at the end of the day, the purpose of it is the same. The purpose is that it's a depository of your business.
So there can be a call to your federal representatives to make this something uniform. You know, there's nothing keeping the federal government from making this uniform from state to state, so everybody's on the same page. And you don't have, like the young lady came in, you have people who, you know, they don't have any proficiency or interest in any of this technology. They just want to be left alone, but you're forcing them to do something and you're not giving instructions. So I don't know, you know, I would suggest everybody give a call to their senators, state senators, federal, and say, you know, move this bill so this is uniform. I mean, that's something we can all do tomorrow.
I don't know. They're so in our business already. I don't know.
You guys, can I add something to that conversation about the portals?
Yeah.
I use 3 of them. I use Cooper, Virtual Health, and Penn Medicine. Wow. And I'm telling you, and I've used them quite extensively over the years, you know, managing my own rare disease. They're similar. I don't know which, like, if we're talking about the same portals, but they're very similar and they all interact with each other. I think through Epic. One of the nurse, I'm sorry, I forget your name, but the nurse that's here could probably attest to that. I forget what Epic stands for, but it's a information system that all the doctors actually share. And if they have access to the other, you don't have to translate or transfer information to, let's say, from your primary to your specialist. They all share the information.
Yeah, they're all in our business. That's what I'm telling you. I don't like it.
I need them in my business because, again, I manage a rare disease. So I'd love to see all, brown or Black doctors. I can't, because if they don't have any expertise in that area, I have no choice. But all of my doctors are Indian, which I'm fine with. And honestly, my experience has been, I've had they don't just look at me as a patient and a dollar sign for insurance. They care about my well-being. When I was first diagnosed, I also spoke at a world conference for rare diseases in San Diego. I spoke to a group of 250 doctors. And I told them the main thing is we as patients need them to listen to us. We're the ones experiencing the symptoms, the diseases, et cetera. So they can practice all day. But if they don't have patients to practice on, what's the point? Listen to us, because again, we're the ones going through it. Every doctor I go to, I have to take information about my disease because it's so rare. And the one thing that got me with my new primary care is she had me at hello because she already knew. She educated herself before I came to her visit. And I think, and no, not being, sexist, I'm not sexist, ageist, but I think a lot of the newer doctors are more exposed to these more rare diseases because I guess it's more in the curriculum now that it's been before. So that's just my experience.
There was a question in here earlier. Tamara, it was your question, something, I'm looking for it in the chat, something about seeing dermatologist. Oh, is there a general dermatologist visit? And this last week, I also heard somebody say that we can have, maybe it was you, Kerry Ann, memory exams, like we should be having a memory checkup. But anyway, go to the dermatologist, because especially living in Florida, Black people think we can't get skin cancer.
Not true. Not true. Yes,
By the
go
way,
to the dermatologist and they can check you out head to toe. And because sometimes, little, especially we have like mold and things like that, beauty marks, and just one over.
We have our physical, and they say that we should also be having a mental health checkup at the same time that we're having a physical checkup. But I don't know.
I'm due for a mental health checkup.
At what point does the dermatologist come into play? Is there some annual exam or annual checkup or that we should be? I know we had the person come on the job about that. So yes, but most of us probably, how many of us aren't doing that?
I'm not.
Yeah, usually like once a year. And then at that point you can kind of check and see, depending on if there's anything, and then you can determine based on that initial exam. Sometimes we tend to have a history of like keloid, if there's something like that. So just kind of check in and determine the schedule based on that initial appointment with the doctor. Another thing I forgot to mention is mammography, mammograms. That's also another important thing that we want to check, because sometimes we tend to have dense breasts and could possibly end up having to do an ultrasound. And now they're doing lots of new things with the mammograms. I can connect you with a really good doctor, a Black doctor, that specializes in she's I can't think of the specialty right now, but she's really good with that as well. And she talked about some of the new things that are coming out with mammography with that as well. And there's also even a breast cancer that's specific to Black women of childbearing age, the triple negative, that don't tend to hear about as well. So there's lots of things that unfortunately targets Black women or Black people. And we just want to make sure that overall we're getting our health checked out.
Yeah, we hear so much that, they talk about these different illnesses. And when I hear them say that it's prevalent in the Black community, I always think, is it really? Or you just really, you're just telling us that because we're supposed to be paranoid all the time. And I
Yes,
have
it
a woman
is.
coming on to talk to us in the new year about Alzheimer's, and even that is more prevalent in women and Blacks. And I was like, and when I talked to her, I said that, and she said she thought the same thing. But she said, honestly, and you said something about it earlier, Kerry, and she said she thought that too. She says, but you know what? It all comes down to diet.
Yeah, I
And as
think the
much as
diet
we,
and the stress.
and stress, of course. Of
Yeah.
course. So if you had to say, both of
That's
you,
it.
Dr. Lewis too, if you had to say, what are the, top 5 things that we know Black people have? Diabetes, hypertension, and we have women on this call. Fibroids are more prevalent with us as well, right?
Yes.
I
And
believe so.
what other things should we be like, that we know that we should be demanding when we go to our doctor? Make sure you're checking what? Cholesterol, diabetes, because cholesterol goes to your high blood pressure, right?
Your inflammatory markers. So SID rate or ESR, CRP, uric acid, like anything that's related to inflammation, because the inflammation is usually at the root of most of these diseases that we're talking about. And it just shocks me how nobody comes in with the inflammatory markers. I actually have to run their inflammatory markers myself because it's just not part of the standard standard chemistry panel, blood chemistry panel. I would also make sure that you run, when they run a CBC, they do a CBC with diff, so CBC with differential. So it shows all the individual components of your red blood cell, all the individual components of your white blood cell, because from the perspective of how we analyze it, you can find so many things that we can catch early on, right? Because it's about prevention and early detection, right? So like the standard blood chemistry panel might have like a 16 CBC, maybe 3 or 4 or 5. Somebody might come to me with 35 or so markers. When I run it, I run 75 markers, right? Because we're looking at the whole body. You're looking at the whole system. And you won't know that your inflammatory markers are out of balance until they check and until they check. And so let's say, oh, we go to a rheumatologist or go to a specialist to get your inflammatory markers run, when, gosh, everybody is dealing with, anybody that has a significant disease is dealing
Angela
with
Williams trap.
chronic inflammatory response. So I would say those two. And then if you know you have a thyroid issue or think you're having issues with hormones, don't just settle for the TSH and the total T4, T3, get a whole profile. So get the T3, the free T3 and T4, get the total T3 and total T4, get the TSH, the reverse T3, get your antibodies, the anti-TPO and TG antibodies. Like, so it's like 10 markers that you would get that would be able to help identify different aspects and why the thyroid is out of balance. And most of the endocrinologists get mad at me. They don't even run it. They don't even want to run it. But that's no problem, because in functional medicine we run it ourselves. So it's that we don't. If it doesn't come in, we run it. But I'm a firm believer. If you can get your insurance to pay for and cover it, do that. Right? Do that. Right? So it is, because when you're going to your primary care doctor or your generalist, right, you should be having an assessment on all these systems, on all the systems, because they're looking at you and saying, oh, this is out of balance, this may, this is in balance. They should be looking at all systems, but the standard way that they're running labs is not looking at all systems. So many things are missed, and then everything is kicked down the road years and decades after it's a disease, quote unquote, when it's too late to, you know, to do a lot of things yourself, right? And there's a study, if I can find it, I'll send you an email on. There's a study that shows that 90 to 95% of chronic disease is in lifestyle and environment, including cancer. Okay, so the most prevalent right now in our communities are, like you said, diabetes, elevated cholesterol, hypertension, you know, all of those, but cancer is a huge component. So you don't want to leave out cancer, but thyroid is huge right now. Any diseases related to stressors, because people are just stressed to the hilt right now. And a lot of female imbalances. So endometriosis is getting, people are being diagnosed more with PCOS, even though I don't really, it's not really showing up as PCOS. I think they're just being diagnosed kind of. So a lot of female issues. So anything related to have your primary doctor, but then also have your OBGYN run as many of those tests as possible as well.
Wow. That is a lot of information. I'm definitely going
I
to
know, I'm
share.
sorry. I know I used to run. I'm used to like, I was trying to get
Yeah,
it.
I'm going to share this video so that you all can actually take notes and be sure to ask your doctors for all of that. Go ahead, Kerry Ann, I cut you
I'll
off.
try
I'm
and
sorry.
copy and paste those tests into the, if I can find it inside my thing, I'll copy and paste it in the chat.
Okay, great.
And I think also making sure that the doctors, because what I also do is make sure that my doctors communicate. So the notes sent back to the primary care. So like my endocrinologist, he sends his note to the primary care. And like, for example, when I was pregnant, my OB was like, okay, you know what? Your endocrinologist, he's been handling all of that. Let's have him continue to handle that and then have him send me the note. So I had 3 doctors that was managing the pregnancy, and they all communicated during the time I was pregnant, just to make sure that everybody was on the same page and that they didn't like overstep each other, but they all knew what was going on and they weren't ordering the same things, but was in communication with each other as well.
That needs to happen too, particularly as we're getting older and every time you go to a doctor, they're trying to put you on medicine. Like, you know,
Right.
medicines are counteracting one another or whatever.
Right. And that is one of the beauties of one of the benefits of the ACA is that now that they have the portal and the medication, so they're able to actually see the medications and should be doing a med reconciliation when you actually go and see them. And one of the things that one of my dad's providers do is actually a pharmacy call. So the pharmacist actually calls and we go through all his meds and make sure that everything is, you know, he's still taking them, if he has any questions and all of that. So we have a pharmacist that actually calls and goes through that with him.
Let me read this last notice here. Donna put in the chat that she said, I was denied life insurance after retirement with a company because of prescriptions listed in my portal. I went to my doctors and had those removed. So again, another reason why we need to be checking our portals, making sure that the information, and I'm assuming from her comment, I'm not, she can speak if you wish, Donna. I'm assuming from the comment that once you had those removed, your barrier to life insurance was also removed. So yeah, that's something. Okay, let's see. Judy, DeAndrea real quick, and then Linda, and we're going to give Kerry Ann back her Sunday. What time you gotta take your baby? Is it time? Oh, it's time. Oh.
Just about, yes.
Okay. Judy, real quick, well, you know what, I don't want to hold you up. So if you wanted to say your, real quick, Judy.
Oh, yeah, so I was going to mention bone health and osteoporosis because in a lot of cases, when you read a lot of the articles, it says Black people really shouldn't have a problem. But I find that nowadays we are actually having a problem, and we're not getting the information early enough that, for example, by age 30, your bones are starting to deteriorate, and there are lots of things that you could do then to improve your health and not wait until you're in your 50s or whatever. And I don't know if they would like to talk to that. But yes, that's one of the things that's sort of sitting out there. And basically what happens is once you're diagnosed, they're now ready to pump you full of medication rather than help you figure out how to prevent it early on.
Yeah, and that's the one I saw a Black female doctor a couple weeks ago, and she ordered a bone density test for me. But she said, make sure it's been 2 years, because if it's within 2 years, they're not going to pay for it. So all this stuff, you're like, it's crazy. But yeah, did either of you want to speak to the bone density situation? Or just, but then, we talk about stereotypes. We think of all
in the chat. That's why I did put chronic vitamin D deficiency.
Yeah.
So that's the other thing you want to add, and make sure they do a vitamin D deficiency test, because that promotes and osteopenia and osteoporosis. And then I did put all the other tests inside the chat for you.
But here's the thing, Dr. Lewis, when we go into the doctors and we say, I want this, I want that, I want this, I want that. First of all, they're going to think, who the hell are you telling me how to do my job? And then if it's not an interest of theirs anyway, we get the test and they don't read, if they're not committed to it, then, they have the results, and do they know what to look for? Do they know what to tell us? I don't know.
So
that's a rough one.
So unfortunately, most of them won't. There's certain tests that they won't run because of insurance. They'll say, well, insurance won't cover it because it's not within my specialty and I don't have the ability to run that test. But then you have another set of doctors who will say, hey, listen, if that's what you want me to run, go for it. I'll go for it. And if you have somebody who can help you understand this, interpret it, then by all means do that. There's a lot of information online also to understand like what the ranges are, and how to help you interpret it. Because again, it's about educating yourself to know where the imbalances are and to understand this, because again, not leaving our information up to interpretation by the practitioner, but you also having a certain amount of knowledge about your health and well-being. So there's a ton of
I gotta interrupt, because I can see Kerry Ann's daughter is like, Mom, I'm ready. So Kerry Ann, I just want to give you a minute. Don't leave us, Dr. Lewis. So Kerry Ann, I just want to give you a minute to give some final words, and obviously to really thank you for giving us time today. I appreciate it. Did you have any closing remarks?
So thank you for having me. It was nice talking with you guys. Hopefully you guys got something, and more importantly, just advocate for yourselves, your loved ones, and enjoy the holiday season, enjoy your loved ones, and that's it.
I'll see you in the new year, my friend. Thank you so much.
Yes.
And I hear it's Donna. Donna wants her great presentation, soror. There's the baby girl.
Hey,
There's
Sarah.
the baby girl. Hello. We're giving you back your mom now, so you can get off to your Girl Scout thing, okay?
The sleepover.
Thank you.
All right. Thank you, Miss Kerry Ann.
Thank you so much.
Have a good evening.
Thank you very much.
Bye-bye. So there's a few hands that are still up, and since you're here, I'm gonna pimp you, Dr. Lewis, so you can answer. You can answer these few. Linda is one, and I'm sure she's got something that will just take us to a whole nother conversation. Go ahead, Ms. Linda.
Actually, Dr. Lewis, I appreciate that. I have a holistic doctor and an intern and my gynecologist. And somebody mentioned before, I was in the hospital 20 years ago. My cousin was my internist. I had my gynecological doctor, my internist, and somebody else. I had all three doctors. So the point she made about making sure, this was 20 years ago. I'm like, I want you all on the same page. That's it. But I appreciate the information you gave. I was going to say, I went to my holistic doctor and he did the whole workup like you're saying. And my cousin had been my doctor for years. And, I have all my reports back to when I was 25. I'll be 70. I have every medical report. But the one I got from the holistic doctor had a whole bunch of stuff. But I noticed that my new internist, she doesn't, my A1C was going up. And I found out that my parents died when I was when they were very young. So I didn't know. but my aunts had diabetes in the 80s and I didn't like pay attention to it. And then my holistic doctor said, you know, you're at 5'8". Now I've been going to the other doctor, and you know, at one point I started saying, are they waiting till you get to borderline before they tell you?
Yes.
That was the impression I got, because
Yes.
she never said anything before. So that made me, you know, kind of uncomfortable. And like I said, I've been watching my stuff to the extent, but the ranges change, or
Yeah.
the companies may change the ranges, or whatever might be happening in the
Change based on
profession.
geographic location. The
I'm sorry.
ranges change based on geographic location as well.
Okay.
So there'll be different ranges, but the general ranges are the same. The reason why they're not mentioning to you that it's an issue, because they're looking for, they're using a diagnostic range. So they're using a range that's going to diagnose the disease. So when you get outside or close to those ranges, or get outside of those ranges, then they'll say to you, hey, you have this condition. With you're dealing with that holistic practitioner you were talking about, and people like me who do it, we're dealing with functional medicine or optimal ranges. So we're looking for wellness. We're looking for you to be in perfect condition, if that's possible, right? As close to optimal as possible. So anything outside of that optimal range, we're going to talk to you about, because we know that that is moving you toward a disease state, which we're trying to prevent from happening. So that 5.8 on your A1C would be a red flag for me, because anything above 5.4, or once we hit 5.4, when you're going into 5.5, we're working on your blood sugar, right? At that point, you're not waiting further
The
out.
other thing, real quick, when my doctor told me that, I said, well, let me order the, you know, I forgot the name of it. They show it on television so you can monitor your insulin. I'm thinking, let me monitor it now so I can see what's going on.
Like the CGMs? You talking about the CGMs?
But what I did, I called the insurance company and I was ordering it, and they said it's like $400. I said it's an investment in me, you know, so I can monitor stuff. What was really interesting, they came back and said I didn't qualify because I wasn't on insulin. Like, you want me to get on something?
Call me. I got you. I can get that for you. Because here's the deal. The deal is that they're only going to offer it based on you having been diagnosed with diabetes, right? Because legally that's what it's indicated for, right? So it's been approved by the FDA for people who have diabetes, but there are ways to get it if you don't, that don't cost $100. So.
Okay.
So we got.
I'll be in touch, because I don't want to get this. I don't want this stuff to happen. But thank you. But I appreciate it. And I was going to ask you to put that list on that you did. So thank you so much. And I guess Helen has your contact information. If I had it, I don't have it anymore.
No worries. Right down the street. Yeah. Right down the street, right?
Yeah.
Yeah,
you guys are both in Newark.
Right down the street. I'm at 71.
71 what?
Right next to Lisa Parker.
Get out.
All right. Okay. All right. Okay. Linda.
I'm recording.
Bye.
Okay, hold on. Okay, thank you, Linda. Somebody on the phone, 678, go ahead. 678, *6, and unmute and go ahead and ask your question.
Hi. Yes, hi, it's me, Helen. Did you say you stopped the recording? You said you stopped the recording?
No, I haven't.
Oh, okay, well, I thought I heard you. So this is a critical question that I have. Okay, so after 65, when I went to the doctor, when the nurse came in, she asked me, are you still having sex? And so I looked at her and I said, well, aren't you? And so I'm wondering, do they ask women over 65 if they still having sex, and do they expect you not to have sex, and then they say you can't get your pap, but every 5 years?
Yeah, so definitely the questions that they ask you are going to be individualized, right? So every practitioner is probably going to choose a different set of questions. But yeah, the determinations based on childbearing years, based on, again, whether you've had a hysterectomy, a partial hysterectomy, a total hysterectomy, whether or not you've had any issues, those are all the timing for your tests are going to be related to your individual situation. So if you haven't had any kind of major issues hormonally or issues reproductively, then they're going to spread those tests out. It's crazy. My mom just was flabbergasted the other day because she was like, I asked my doctor for a colonoscopy and they said they don't test people at 85 for colonoscopy anymore. So there's certain diseases and conditions that you won't even be able to get tested for at certain ages, right? So that's going to change. That changes based on what the industry standards are. But yeah, they can ask you those questions that they ask are subjective. They can much
They
ask.
also start asking you, have you fallen? Like, why would I have fallen? Because when I turned, I don't know, late 50s, 60s, like every time you go to the doctors, they ask you, have you fallen? I'm like, why would I have fallen? Like, really? And then I get it. But my girlfriend also said, if you do fall, don't tell them, because then they're going to say you can't live by yourself.
But see, Helen, for me, it's critical because I am a high fall risk because of my disease. So I guess
I get that, but I'm not.
No, I know. I'm just saying it depends on the individual. So why don't you make that like across the board?
Yeah.
Yeah.
But I think it's just the age thing. Like you're at an age and we have to ask you. And I'll tell you another thing, I think, honestly, I don't even think it's an age thing. If we live alone,
yeah.
Those bandages those bracelets they have for people. We need something for just people. I have one of my cousins, they think he was dead in his apartment for 10 days and nobody knew it. And I have a good friend, she was dead for, they said, at least 3 days. When I worked for the airline. So I think that's a big thing. And we think it's just for older people, but really my cousin he was 50, but it could be anybody. I could fall. So I said, it doesn't have to be, some ugly bracelet or something, but they need to come up with some kind of way for, people to alert.
Apple Watch.
They can put it on like the iWatch. Does it have an
iWatch?
On the iWatch. Yep.
Yeah.
Yeah. See, I don't use, I told you I don't like technology.
It has fall detection on it.
I have that watch. It's on the dresser at home and it's been there since I bought it. I wore it for about a month. I'm like, I don't have time to figure this all out. Anyway, go ahead, Sis Star. I see your hand. Go ahead, sis.
Okay. Thank you. This is Sister Bay from Jersey. And again, I want to thank Professor Linda for inviting me. I truly enjoyed all of the conversation, but my situation is, and I would like an answer. I have fibroids and I've had it for, I'm going to say approximately maybe 25 to 30 years. And it never used to be an issue. But since the latter years, 7 or 8, I do feel like I do have pressure in that area on the left-hand side. But I have a girlfriend who's a nurse who said if she thinks that I should had it taken out, even though it wasn't bothering me. But I like to hear what the nurse has to say.
Well, the nurse is gone. Now we have a doctor in the house.
Okay, that's even better. Ask doctor, tell me what I should do.
So it's hard for me to tell you exactly what to do without having your entire history, right? But here's the thing. My concept of what you should do is going to be very different from what your Western medicine doctor is going to, because I look at everything from a completely different vantage point, right? So I'm not going to wait 20 years. I'm not going to wait 20 or 15 years. If I know you have a fibroid, I'm going to start treating the reason why you have the fibroid 20 years ago or 15 years ago to help reduce and dissolve and all that fibroid. I'm going to be working on that on you with that fibroid, trying to get rid of it during that 20 years or trying to prevent more from growing. Like I'm going to be working on that, right? So if I see it's there, I say work on it, right? Their option of working, right? Because that's kind of the Western medicine way for fibroids. But we already know that after 6 months, depending on the cause, after 6 months, they'll usually grow back, right? Because the reason why they're growing in the first place hasn't been resolved. The surgery is just removing the fibroid. It's not removing the reason why it grew, right?
Makes sense.
So we have to always look at the root cause and the why. So it can be a estrogen imbalance, like ever heard of estrogen dominance when estrogen is too high, right? It could be that the estrogen and progesterone aren't balanced, so that estrogen is just way too high, right? It could be bacterial or viral, like so many people don't recognize, like the uterus is here, the colon is here, right? Smacking right up against the uterus, right?
Right.
Bladder right in front, right?
Yeah.
So it could be, a lot of people that have chronic constipation or their
That's
bowels are.
me. I have that too.
So a lot of times those bacteria and viruses slide right on into the right and create, and so the body creates fibroids to wall off things, right? So
Yeah.
so the goal is we always have to do the work to say, hey, what is the probable cause of this? And then we start working on that cause. So we don't want to wait for you to get major symptoms when we start working on those causes now, right?
All right.
And so my answer is yes, you should be working on it yesterday, right?
Are you
But
accepting new patients?
but surgery isn't always surgery. If you're having severe symptoms, you got to wear a diaper because because your flow is that heavy, right?
I'm not there yet at
Having
65. I'm
pain,
still very
that kind of
young,
stuff.
like the rest of us.
Oh, no. So you definitely want to always have ultrasounds in the check and make sure you know what the sizes are and the locations and all of
Yeah.
that, right? You
All
use
right.
technology for that. And then you want to use natural medicine or some kind of therapies to help address why it's there, right?
All right.
And
An
and
address.
and okay, and I see constipation and try probiotics. So probiotics are good for helping to grow bacteria, healthy bacteria, but they don't help get rid of
That.
excess bacteria, right?
Yeah.
So there's something called systemic enzymes that help to break down tumors and break down scar tissue and things that the body doesn't like it's like rotor-rooter for your body.
Okay. Thank you.
Again, we talked about that CBC, that complete blood count, where I talked about getting the differentials. If you look at your white blood cell count, and they have multiple different places in that white blood cell count where you can see, is it bacterial? Is it a viral issue? Is it a parasite issue? Like we can see that from those labs, from those basic labs that you get every day. We can see so many things, right? And so and you also look at your estrogen levels and all those kinds of things. And then when we see that, we can say, oh, all that investigation then tells me, voila, here's the probable causes. You start working on those probable causes. Most of them, again, lifestyle, environment, diet, like toxic overload, the liver not working as effectively as it needs to. Like there's a lot of different reasons. And once we know what those reasons are, boom, then we start working on it. That's the
Sound like a
difference.
plan.
That's the
Thank
difference.
you.
You're welcome.
Appreciate that. I'm
She
gonna
asked,
look you up. I'm gonna look
she
you
asked,
up.
I'm
she
here.
asked, she asked Dr. Lewis, and I'm sure other people are going to be wanting to know the same. Are you taking new patients?
Oh, we always take new patients,
Oh,
right?
Okay.
There,
So
but
make
there's
sure.
a, but there's a lot, there's a lot of different ways to work. Like everybody, I always tell people the common way that medicine is practiced is like the current paradigm of medicine is a little bit archaic, right? Because what you're getting right now is information, right? You need to learn and understand how your body works, and then you use the knowledge of the practitioner to guide your therapy. So a lot of ways that I work with people, especially because most of it is virtual, is by educating you by information that I already have in a portal. I have programs that teach all this. I have memberships. I have concierge.
Good.
A lot of different ways to do it. So what I usually do is set people up with like a discovery session, like a discovery session where I can get to know you, because I don't treat conditions, I treat people, right?
Thank
So
you.
to know who you are, what your challenges are, and then from there I can guide you to the proper place that you should go for your care. Because everybody doesn't need me sitting across the thing from them one-on-one doing that work, right? Because you talked about insurance doesn't cover it and yada, 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 right? So there's a lot of ways to do it to fit everybody's lifestyle, to fit everybody's budget. It's just a way to make it happen. I'll put a link in there to help
Yeah.
people.
Thank you so much.
Yeah, no worries, no worries. But remember, every individual, every person, even if you have the same condition, you can have a different cause. So your route toward healing is going to be different, right?
Gotcha.
Absolutely.
I have a
Awesome.
question on somebody sent to me on my phone, and then I'm gonna let you go because this was just a bonus.
I'm writing social media posts right now, so that would be.
An ovary on the cyst. Should it be
It's on your ovaries, right?
right?
Yep. So ovarian
What did
cyst.
I say? An ovary on the cyst.
No
Lord Jesus.
worries,
A
no worries.
cyst on the ovary.
Depending on how large it is, sometimes you may, and type of symptom is creating you, that may be at a surgical place. It may be at a place where you need surgery, right? But you still have to, after surgery, you still have to treat the reason why it's showing up, right? And there's a propensity. So a lot of people that have a cyst on the ovary might also have had cysts in the past that they didn't recognize that their body had, this susceptibility to creating cysts, right? So one of the things, again, we want to see, is it walling off some kind of bacteria or viral or something like that? Is it associated with endometriosis or any other kind of conditions? Is it related to your hormones, right? We can see that from your labs, from your primary blood work, right? And then we'll be able to say, hey, this cyst is related to this. And I am I was trained in holistic medicine and naturopathic medicine, but I'm also, my background is in Western medicine, right? So I believe in the marriage of the two. I am not the person who believes, oh, you got to do everything holistically, because sometimes you can't. Okay. Sometimes you're past that stage. You can do things to support, but sometimes you got to go in for that procedure because you need immediate care, right? And so the concept is understanding where you are, what stage you're in, so that you can best make the decision that's going to support long-term healing, right? Not just a short fix, because we're used to the quick fix and a short fix, but that long-term healing is really the point. So for that cyst, I would say, depending on how large it is, depending on whether it's really affecting your ovary, depending on where you are in your reproductive cycle. Like, are you trying to have babies? They say that the ovary is going to affect your fertility. All those things will come into play when we determine what's your next step, right?
Okay.
And that's important. Yeah.
This is a crazy one. She says, when my mother was diagnosed with lung cancer at 83, they asked if she had ever had an abortion. What in the world? I don't know. There's a connection.
Let me tell you, these people, you wouldn't believe the stuff that I hear my patients say, and I'd be like, you can't possibly say, and I'm like, listen, this is what it's just craziness.
Wow.
Yeah, it's just
so
crazy.
I can tell that they want. Judy said, was it a red state? She's from the lady who posted that. She lives in New York, so I don't know if she wants to talk about it or not. But I was like, that's kind of crazy.
Well, if it was a functional medicine doctor, right, they could have been asking you questions about general history and things that have been happening to you, because certain systems.
She's 83.
I know, I'm saying.
If she had an abortion, it was more than 50, 60 years ago.
Trying to help her. She probably don't even remember.
That's crazy, right? That's crazy. Yeah. But the thing is that, but at the end of the day, ladies, and Lenny, is Lenny still with us? Lenny was the only, and that's
still
my
here.
fault. Hey, Lenny, then to send it out to, I didn't, and Dr. Lewis, what you don't know is 90% of the time it's just women, but we invite our men to conversations. And because I was thinking we were all, anyway, I should have invited them today, and I did.
OBGYN is my specialty.
Really? Are you a doctor?
Yes. No, my wife was an OBGYN nurse, and I was pre-med, so we studied together for a while.
Loved it. See, I never knew that, Mr. Lenny.
That's powerful.
Okay. So yeah, but anyway, so we're getting a request that, and I when I saw Dr. Lewis, I said, "Are you an MD?" Because one of her questions, and actually I thought, she looked familiar. Have we had her on here before? We've been doing this for 4 years. It'll be 4 years in March, and I can't. I forget some. We've had so many guests, I don't remember them all. And I said, gosh, she looks so familiar. I'm embarrassed to ask her because what if it's
Are
somebody
you
who
in,
didn't
are
hear
you
me?
in you were in northern New Jersey or southern Jersey?
So I was in southern New Jersey, South Jersey, but now I'm in Florida. Oh, that's another thing too. I'm glad you brought that up. So people who are listening to you, even though they don't live in New Jersey, it sounds like you're doing telehealth. So
Oh,
no matter
yeah,
where they.
virtual. Yeah, all the support is virtual because remember, it's about education, right? And so most of what you're doing in your home, right? All the things that we're making recommendations for you to do are the things you're doing every day. So able to do virtual medicine since 2006 because it's about the relationship, understanding what your challenges are, understanding you as a whole person, and then creating the strategies and the support you need to move through your healing process. Again, that old paradigm of medicine thinks that you got to show up to an office, you got to do everything the same way. And that's not, so my practice didn't change from the pandemic because I was already set up to do everything that way since like 2000. Well, it's 2009 really, because I moved out to LA. I was practicing in DC and I moved out to LA, and my DC patients, my Maryland patient was like, I don't care if you move to the moon. You're gonna have to figure a way to still support me.
So I'm getting requests for you to put your contact information, however people can, whether it's your website, your phone number, whatever you're comfortable with, if you can leave that with and I'll send this out to those of you who if you don't copy, I think you should copy the chats today. And that's go to the bottom of the screen there and see those 3 dots and hit on them and it'll tell you to copy the chats, save chats. And that's what you want to do.
And then I have I can put my my website and the office number. There is, as you can tell, I like online. So there is an option for you to fill out information for a complimentary discovery session on every page of the website. So every page at the bottom of the website, you can click that button, fill out the information, schedule an appointment. But the fastest way to do it, if you're doing it throughout the day, is just to call my assistant. So I'm gonna put my my website
Whatever you're
information.
comfortable. And if you're not, you can, if you want to send it to me and I can send something out later, that's fine. Whatever you're comfortable with.
You don't have Sister Bay's info, so I need it. Thank you. Peace.
It's in the chat.
Oh, Sister Bay, I got your info because you just when you logged on, you gave me your info.
Right. That's right. I'm part of the posse now. Thank you.
Yes, you are. Yes, you are. This has been a good call, spontaneous. We didn't get to talk about where we were for the last, like I said, it's coming up on 4 years. Linda said we've been doing this longer than some TV shows. She loves to tell me that. So yeah, so we were going to talk a little bit, but it's getting late and I respect everybody's time. So oh yeah, she's on my posse. That's right, Judy. So let me stop this sharing. Dr. Lewis, I'm gonna be in touch with you, girl, because I need a consult, I'll tell you right now. So I will definitely be in touch with you too.
No worries. I'd be happy to. And then if there's a particular topic and you like for me to prepare something for you and relate it to a particular condition or whatever that looks like, I'm happy. Now I'm be part of the posse too.
You're part of the posse too. So let me stop the spotlight and then we can do just a quick little something and say goodbye. It's a new year. Yay. Can y'all believe it? I cannot believe the year is gone, but it is. So is anybody, before we sign off, just have anything that they just want to share about the previous year and what you got going into the new year? Done a year of these calls this year. Is one stand out for you? Is it something that you want to see more of, less of? Any kind of guests that you have in mind that you want us to get on here? Just any feedback anything you want to share in these last 5 minutes that we're going to be here.
Helen, I would share and remind you, I'm driving, that the 4 years that I've been connected to you to the hip, no, this is, for people who haven't been on, this has been an evolution. I mean, I don't think Helen even had the dream of what it has become. She had, I don't know if she told you guys beforehand how this came about. She was just checking on friends around the world, and it evolved to where we are now. Some of the programs, and Helen has a channel, a YouTube channel. So I hope she invites people to go on and see some of the past programs. You can use them, you know, and this has been wonderful. Thank you, Dr. Lewis. I'm going to crawl over to your house. But yeah, it's been an amazing journey. I had no idea that I could be involved in something like this. Yeah, and Helen, you know, whatever she wants to do, I just jump on board. But it was interesting when COVID hit, all I could think about, nobody's gonna come to my house and I can clean my house and get all these books and paper out. Little did I know what I was in store for. So, you know, I'm glad that people have been coming. It's been an amazing journey, and you know, almost 4 years. We're short 3 months of 4 years. That's
Yeah,
interesting,
that
to say the
is,
least.
yeah, I can't believe it myself. Go ahead, Judy.
Yeah, I may be in the wrong year, but well, first of all, pretty much all of the medical-based programs that you've done, I think have been exceedingly helpful. But the one where you had the male doctors come in talking about mental health,
Yeah,
it's really important
yeah.
for everybody. Yeah.
Thank
Thanks.
you. Yeah, we definitely we have a lot, and Michelle is gone. And Kildea had a situation. She's not here today, but yeah, we definitely get requests to have them back again. Okay, Miss Reynolds, what you got to say?
Well, I just want to say I don't remember exactly how I stumbled onto this program, but I've been so thankful. At age 6, I'm still learning, and every time I'm on this program, I learn something new. And I want to thank Helen for starting this program. And every time I'm in a group of ladies, I tell everybody about it. I don't know how many have joined the group, but I'm on as much as I can. I live in California. I'm actually in Colorado right now, but I made sure I was on this program today since it's our last one for this
Right.
year, to just be sure and thank Helen for a very interesting year and an interesting 4-year ride. And keep up the good work, fellow Bison.
I will. And I'm gonna be in LA, I think, next month. I don't know if you saw my note, so we can talk about that. You're in the LA area?
Yes, I'm
Oh.
in north of LA in Ventura County.
Oh, well, I look forward to meeting you when I get out
Yeah.
there. Somebody was saying what we used to do every third Sunday. I would have people who were living in other countries come and talk to us about that, and I haven't done that in a while. We also, ladies, have not met with our white women in quite some time. As a matter of fact, we didn't meet with them at all in 2023, so we might want to revisit that just to get general conversations going. I will try and do, we definitely are going to do Oklahoma, and we're going to go in Memorial Day weekend. We're going to head out to Tulsa, and it is the anniversary, I don't like that, commemoration, I guess, of the Tulsa massacre. So we'll go out there, and we're also going to go to a Black rodeo while we're there. I'm in Costa Rica right now, so I'll look around here and see if there's anything that we want to do to come here. And of course, I was in Jamaica 3 weeks or whenever ago, and we'll do that too. And of course, there's always interest in going to Senegal, Cuba. Cuba's high on the list. So just bear with me. And I think, huh? I think Judy put in the chats here. I need to, and Kilty was telling me too yesterday, I need to stop trying to do everything myself because I just can't. So we're going to go back. The suggestion is that I put together some committees and we start doing some planning so that I'm not trying to do everything. So there's some people will be looking at trips that we can take, some other people looking at guests. Interesting guests. I've gotten a yes from Harriet Washington. I know you know who that is, Dr. Lewis. She wrote Medical Apartheid. Yeah.
I add coconut milk and coconut oil.
I was just watching the last season of High on the Hog.
Oh, wow. Okay. So yeah, but anyway, folks, we're going to do a whole lot of stuff in 2024. I keep saying I'm going to change it from Sunday, and maybe we will finally play with another day. But then I hear people say, girl, you know, you hold church every Sunday. So I'm trying to stick to it, but it gets a little difficult when I'm working and it goes, you know, goes late and whatever, but we'll work it out. But I just want to say thank you all for your continued support. Thank you for showing up. It's a new year. I don't make resolutions, but I do think it's a good time to stop and reflect on where we were and just, you know, have some kind of roadmap as to how we want to go forward. There's nothing wrong with that. Just don't make promises to yourself that don't beat yourself up about making promises to yourself that you may or may not keep. We're all human. And, you know, get a buddy to keep you on track if it's something that you really, really want to do. We started out last year with Principal Michelle, and she did, what do you call it when they're the road mapping? What do they call it? Vision boards, the vision boards and what have you. So I don't know if we'll, you know, that's important. We'll do that again this year. And I'm happy to say that, Judy, there's been a couple of groups that have just stayed. People have lost weight. So the weight loss group, they kept going. The declutter group, they kept going. What else, Judy, am I missing?
We were in a Write a Will group. Actually, we're still in it. And we're also in a unclutter group for most of us who have lived long lives and need to get rid of our stuff so our kids don't have to.
Yeah.
So we're actually still meeting. We're meeting on a larger interval now than before, but we're still
Right.
meeting.
So yeah, so there's stuff going on. And I think, you know, I do this for you all. And I'm appreciative of everybody who continues to come and support. Some of you send me donations quite regularly. I really appreciate it. That's the other thing, you know, I need to talk about how to monetize this in some way because it is a lot of work for me. Trying to keep it together, but we'll work that out. I said that last year, so here we are in another year, and I still haven't monetized. So it'll be very minor.
I have a question. I have a suggestion. This is Sister Bay from Jersey. It would be nice for all of us who are entrepreneurs if we could put together some type of resource pamphlet or booklet so we can support each other for 2024.
That'd be great. That'd be really great.
It would be even better if we did a calendar, but it's too late now to do a calendar for 2024, but for the future, and that could be a fundraiser.
Right.
I think Kiltia had something going with Black businesses, so you might want to talk to her.
Okay.
I would add that the NAACP several years, like decades ago, there's a model you may be able to get online that already exists that the NAACP did for the whole country. Yeah, so I think I have an old version at the school. I'm supposed to be moving from the school, but yeah, I know you may be able to get it online, but there's some things that are already done, so you don't have to reinvent the wheel. Just update.
Yeah, but the one I'm talking about is for us, the sisters that's on this line right here, right now.
Yeah.
Oh, no, I understand.
Oh, the other thing I do want to say, I definitely will do this in the new year, because it's one thing I'm going to do while I'm down here in Costa Rica. I'm going to create some paraphernalia, whether it's T-shirts or coffee mugs, and I hope you guys will buy them and give them out as gifts or what have you. I should have had them ready for Christmas, but I got too much on my plate, but we're definitely going to do that. Yeah, merch. That's right, Judy. Merch. That's what the young people call it. Merch. So anyway.
We're all young. What you talking about?
Yeah, we're as young as we feel. And until I
We
try to walk or
teenagers. Hashtag SEENAGER. That's what we are. We've seen a lot of stuff in our lifetime. Them teenagers think they got us beat, but they don't.
So on this note, can everybody unmute? We'll do our, people are signing off anyway. So let's just do our farewell for the end of the year and show Dr. Lewis what we do, because she hasn't been before. I don't even know if some of my regulars are here. I don't know. Judy, who's here?
What's the
All
YouTube?
right, I'll just do it. Whoever's on here will do it. So thank you.
We're still recording.
Yeah, we are still recording. I just wanted to say this has been another amazing Sunday, and I thank you so much for coming. And we all know that when Black women gather,
Amazing
things
happen.
Welcome to your
Amen.
amazing.
Happy
holidays,
Merry
everybody.
Christmas, happy
holidays,
Kwanzaa.
Holiday
happy
all.
Kwanzaa.
Peace and joy to
Kwanzaa.
everyone.
Thank you all for another amazing Sunday.